Green.
Man. Oh, make myself. I can get up on it too.
What? Wow. That's cool.
Why are you really sad like
I
this?
don't know, I've had this pain ever since I got it. I don't know.
Because all that junk food you've been eating got indigestion. Is it called
Aren't you
indigestion?
diabetic
This nurse is indigestion.
Yeah, I am diabetic. Speaking of that, I forgot my insulin. Yeah.
My name is Howard Reeves. I like to be called Jonathan Walton. I used to work for the post office. I also have 3 kids and a wife back at home, but I left them there to film The Real World. I have some of the things that people don't know about me is I have diabetes and also hypertension. But I really don't take care of that because I came here to film The Real World. I left everything at home.
Man, look at this. You really tear it out.
Yeah, I did.
You
My
need to make
stomach's
more
torn
healthier
up a little bit
choices.
right now.
Really? You alright?
I don't know, this side's here.
You don't look too good. Yeah, look at all the stuff that he ate.
Yeah, I don't eat no like y'all, man. I eat like a big boy. I got pain right now on my right side, all the way up to my shoulder. I'm feeling nauseous, man.
That doesn't sound too good.
Yeah, I think I'm gonna go lay down. I'm feeling nauseous, man.
You should probably go lay down.
Oh, man.
You're gonna. Oh. You okay? Go 911! I'm calling! I think he's having a heart attack. 911, we have an emergency.
Generic name Meperidine, trade name Demerol. Its therapeutic classification is an opioid analgesic, and its pharmacologic classification is an opioid agonist. Demerol's indications are for moderate to severe pain. It is also used as an anesthesia adjunct analgesic during labor and for preoperative sedation. Demerol's mechanism of action is that it binds to opioid receptors in the central nervous system. It also alters the perception of and response to painful stimuli or produces generalized central nervous system depression. Its therapeutic effect is a decrease in the severity of pain. Some adverse effects include seizures, confusion, sedation, dysphoria, euphoria, floating feeling, hallucinations, headache, unusual dreams, blurred vision, diplopia, meiosis, respiratory depression, hypotension, bradycardia, constipation, nausea, vomiting, urinary retention, flushing, sweating, allergic reactions including anaphylaxis, physical dependence, psychological dependence, and tolerance. Some patient and family teaching includes instructing the patient to take meperidine as directed. If dose is less effective after a few weeks, do not increase dose without consulting healthcare professional. For pediatrics, teach parents or caregivers how to accurately measure liquid medications and to use only the measuring device dispensed with the medication. Demerol may cause drowsiness or dizziness. Advise patient to cough assistance when ambulating or smoking. Caution patient to avoid driving or other activities requiring alertness until response to medication is known. As a nurse, you want to assess type, location, and intensity of pain prior to and 1 hour following by mouth, subcutaneous, and intramuscular doses, and 5 minutes following IV administration. Assess blood pressure, pulse, and respirations before and periodically during administration. If respiratory rate is less than 10 per minute, assess level of sedation. Assess bowel function routinely. Prevention of constipation should be instituted with increased intake of fluids and bulk and with laxatives to minimize constipating effects. Prolonged use may lead to physical and psychological dependence and tolerance.
Mr. Watson?
Yeah.
Hi, how are you?
Alright.
Alright, my name is Maria Montezioca. I'm the nurse today, okay? We're gonna do an assessment on you today, alright?
Okay.
So let me go ahead and wash my hands. I'm just gonna put my gloves on. How are you doing today, Mr. Walton?
Feeling a little bit nauseous. You can call me Jonathan, by the way.
Jonathan? Alright. gloves on. Can you please state your birthday, your name and your birthday?
Yes, my name is Jonathan Dennis Walton, 11/17/1987.
Alright, do you know where you're at right now?
Hospital.
Hospital? Okay, how are you feeling this morning?
A little bit of pain on my right side.
Can you describe your pain for me?
Just tender.
Tender?
Yeah, radiating a little bit to my right shoulder.
To your right shoulder?
Yeah.
And on a scale from 1 to 10, with 10 being the worst, how bad is your pain?
About a 7/8.
7, 8? Were you vomiting earlier?
Yes.
Vomiting? Okay, check. You seem a little warm. I'm gonna take your temperature, okay? Let me put this around your eye. Okay, go ahead and rest your eye. Put this on your finger. There you go. Okay. Seem a little warm. I'm gonna take your temperature, okay? Under your tongue. Okay, temperature's a little high. It's 101.2. So we're gonna go ahead and tell the doctor this. Your blood pressure as well is a little high. It was 145/80. So we're gonna go ahead and put that in, okay? Take this off your finger. Your O2 is good. It's at 98. Okay, I'm gonna go ahead and do an assessment on you, okay? I'm gonna go ahead and clean this at the school. Can you point to me again where your pain's at exactly?
Yeah, like
Right there? Okay. I'm gonna listen to your heart first, okay?
Alright.
And I'm gonna listen to your lungs, so just take a deep breath for me, okay? One more time. Okay. Where is it at again? You said on this side? Okay. I'm gonna go ahead and inspect your abdomen. Okay, that's fine. I'm gonna go ahead and listen to it. Your pain's over here, right?
Mm-hmm.
Okay. Okay. Feel your stomach, but I'm gonna do it lightly, okay? Let me know if you feel any pain or pressure.
Yeah, right there.
I'm sorry. Okay. When was your last bowel movement?
A couple days ago.
A couple days ago? Alright. Okay, before I leave, I just wanted to let you know some things that I noticed about you. Your skin seems to be a little bit yellow. Have you always had that skin tone, or?
No, it actually started up around when the pain started.
Okay, and that urine sample you gave us this morning, it seemed a bit dark. And as well, and also your temperature's a bit elevated and your blood pressure's up too, so. Mr. Walton?
Yeah.
Hi, how are you? I saw that the doctor just put in an order for an ultrasound. He wants to check out your gallbladder. We want to see if there's anything going on.
Okay.
Alright?
Hello, Mr. Walton.
Hello.
I'm Dr. Siegel. How are you feeling?
Yeah, alright.
You're feeling alright? Well, we ran some tests. I'm going to be your doctor from now on. We actually did an abdominal ultrasound and we did a liver function test and a CBC. It turns out that you have cholelithiasis and cholecystitis.
What is that?
What that means is that the cholelithiasis is actually gallstones that have formed in your gallbladder, which have then caused inflammation of the gallbladder, which is cholecystitis, and therefore they have caused, the gallstones to travel into the common bile duct, into the bile duct, which have then caused obstruction. And in your case, you have so many, gallstones in your common bile duct that it has caused such a big obstruction that I'm gonna have to go in and do an open cholecystectomy tomorrow. It's for the best, and your gallbladder needs to be removed to relieve you of your pain. You know, also I know that you came in and told the nurse that you had been eating some bad food and you have a history of diabetes.
Always eat like that. I used to be pretty overweight.
Yeah, it's probably not the best, especially with, you know, now that you have a gallbladder problem and that we're going to be removing your gallbladder. I'm going to have a nutritionist come in and talk to you. And I also have this pamphlet to give to you that can give you some information about the procedure, can give you, you know, information about what you're going to have to, you know, expect for the procedure and for after the procedure, you know, the risks and the benefits of the procedure, and basically everything that you're going to, you know, the test that we had to do and the condition, what it entails.
Yeah, you think I can get anything for pain or nausea?
Yeah, you know, I'll put some orders in for pain medication, and I'll put an antiemetic in for your nausea. And we also set you up with some fluids to make sure you're hydrated, because you're now gonna not be able to eat or drink anything before your surgery.
Okay.
So I'm sorry about that, but we need to make sure that you don't eat or drink anything. And we're also gonna put a catheter in you, and possibly have to put an NG tube if necessary before surgery. Okay?
Okay.
All right. If you have any other questions, let your nurses know, and they'll contact me. And I hope that you feel better. And then if you need anything, just let me know. Okay?
Were you recently diagnosed with cholecystitis, and are you experiencing bouts of nausea and vomiting? If so, you need Phenergan, generic name promethazine. Promethazine is an antihistamine. It works by blocking a certain natural substance known as histamine that your body makes during an allergic reaction. Its other effects, such as anti-nausea, calming, and pain relief, may work by affecting other natural substances such as acetylcholine and by acting directly on certain parts of the brain. Before using this medication, tell your doctor or pharmacist your medical history, especially of breathing problems such as asthma, chronic obstructive pulmonary disease, and sleep apnea, blood immune system problems such as bone marrow depression, a certain eye problems such as narrow angle glaucoma, heart disease such as angina, irregular heartbeat, high or low blood pressure, liver disease, certain nervous system problems such as neuroleptic malignant syndrome, Reye syndrome, seizures, stomach bowel problems such as blockage or ulcer disease, sun sensitivities when using other medications, urination problems due to enlarged prostates or blockage. Some side effects associated with Phenergan is drowsiness, dizziness, constipation, blurred vision, or dry mouth may also occur. If any of these side effects persist or worsen, notify your doctor. Since this drug can make you dizzy or drowsy or can cause blurred vision, do not drive, use machinery, or do any activity that requires alertness or clear vision until you are sure you can perform such activities safely. Children should be supervised during bicycle riding and other possibly hazardous activities to avoid injury. And most importantly, avoid alcoholic beverages.
Good afternoon, Mr. Walton. How are you? My name is Delia. I'm your new nurse. Are you mom?
Yeah.
Nice to meet you.
Right
Nice to meet you.
here.
So I got the report, and it seems like you're going to be having surgery tomorrow.
Yeah.
Do you have any questions about the surgery? I see that the doctor gave you a pamphlet.
Yeah.
Did she explain to you the risk factors of why you're having this condition?
No. How did I get this?
You know, some of the risk factors could be diabetes, which I saw you chart and you are diabetic. Also, a diet high in animal fat, which is, that's why he put a referral for the nutritionist. And of course, obesity, which, you know, you're not.
Nah, I used to be.
And of course, some of the other risk factors that you don't fall under, such as female, being pregnant, and, you know, older. You did mention also that you had rapid weight loss.
Yeah.
Unexpectedly. Yeah, that could be a risk factor for your condition. But we're going to get you all set up. I know she put up an order for some pain medications for you, some nausea. And we set you up with fluids. I know they gave you something for your temperature. And we're going to get the UAP to come in here and take your temperature to make sure we monitor that before the surgery tomorrow, okay? So from now on, just ice chips, and I'm going to come in a little bit and show you some methods that he can do to alleviate some of the pain before the surgery later tonight or after the surgery, which is going to help you get home faster. Mr. Walton, I have your pain medication here. Just gonna wash my hands, okay? Okay, the doctor order for your pain, she ordered meperidine, which is also called Demerol. This is an opioid, which is a painkiller. You're gonna get some confusion. Some of the side effects might be confusion, blurred vision, but the main one is respiratory depression. So if you're having any difficulty breathing, please let me know right away. Okay? Can you state your name for me?
Yes, Jonathan Walton.
Okay, date of birth?
11/17/1987.
Okay, do you know where you are?
Yes.
Do you know what date it is?
July 2nd.
Okay, that's gonna relieve your pain, okay? So give it about 15-20 minutes to take effect. Okay, and I'll come back and reassess to make sure the pain is alleviated. Okay, also so you know the doctor ordered an antiemetic, promethazine for your nausea.
Okay.
And also it helps with the vomiting. Again, some of the side effects are drowsiness, dizzy, constipation. You might have blurred vision, but you are going to experience dry mouth. Okay. So let me know. Also, she asked for an antibiotic, Levaquin. This antibiotic is usually will protect you against the E. coli, which is a bacteria. And this antibiotic is usually used to treat a wide variety of bacteria, just to make sure we get that infection under control. That is going to give you side effects: nausea, dizzy, constipation, headache, and you might have trouble sleeping. So let me know if you experience any of that, okay? Do you have any questions? Okay, so I'll come back and reassess, and I'm going to go get some of the stuff to teach you about the splinting and deep breathing exercises that you can do to also alleviate pain, okay? I'll be back.
I'm not passing my phone.
Okay, Mr. Walton, I got a pillow, which I am going to show you some of the maneuvers that you can do to alleviate some pain before and after the surgery, okay? With the pillow, what I want you to do is you can fold it in half. You're going to put it in your abdominal cavity, and you're going to cough. When you're coughing, you're going to do something called splinting, okay? This is going to alleviate some of your pain, and it's also going to prevent after the operation from the incision coming apart, okay? You can also do some exercises to promote circulation. We are going to have some post-ocs on you. However, after the surgery, I'm going to come in and monitor you and teach you how to do the exercises, okay? Also, I'm going to, when you're need to deep breathe, because we need to prevent pneumonia after surgeries and so on, any complications. You're going to take both hands, put them in your abdominal, and take a deep breath. And that's going to alleviate some pain, okay? Do you have any questions? Mom, do you have any questions?
Not for me. Is there anything
Do you want to watch some TV?
Yeah,
Take your mind off the pain?
He
loves TV?
Yeah.
Okay, here's the remote. Should be over there on the side. We'll give you the remote. And also, Mom, I did print some instructions as well for you to take a look at and see if you have any questions for other methods to alleviate pain.
Okay, that's
Okay?
Hello, Mr. Walton.
Hey.
My name is Brandy McDaniel. Hello. Are you his mother?
Yeah.
Okay, I'm the nutritionist, and I'm going to be telling you how you can improve your diet so you can prevent these gallstones. Are you aware of what can lead to these, what foods?
Not really.
Alright, well, I'm going to just tell you some. Alright, you need to avoid foods high in animal fat, which would be like eggs, cheese, steaks, like the high-fat stuff. You need to avoid foods that are starchy, such as potatoes. We have bread and pastas, and you need to eat more food and fiber, such as fruits and vegetables. I know you may not want to do that, but for your health, you really need to take it in consideration.
So hard to do when I live in that
And
house.
as the mother, for teaching you as well, you need to make sure or cook healthier foods, or you need to enforce it better. Because
I will.
you will, okay. And just, you know, as your mom, just check on him and make sure he's eating healthier foods, fruits,
Not eat healthy
vegetables.
So I can't be drinking with my buddies back at the house.
No.
Uh,
No. So just keep an eye on him, and as you need to eat a healthier diet. Okay, Mom, can I have you for a minute? I just wanted to give you some pamphlets. All right. I know that, you know, he's young and stuff like that, so I really need you to be on him. And as a mother, just really enforce the food. So I'm going to give you a pamphlet that has all the foods that are really essential and good for him.
Okay.
All right? And so just be a support system, be there for him. And if you have any questions, just give me a call.
Okay, thank you.
All right, Mr. Walton, if you have any questions or no?
no. Thank you very much.
All
I
right.
appreciate your
You're
help.
welcome. Have a great day.
Con los terroristas.